which is the first center in the United States to provide comprehensive care for intensive care unit survivors. The Critical Care Recovery Center is an outpatient clinic in which patients come and seen by a critical care physician, which is myself, just like any other clinic, like a primary care clinic where people go see their primary care physicians. Except here, what they're seeing is a specialist who's an ICU doctor who most likely have provided care for them while they were sick in an intensive care unit. So it provides a spectrum of illness starting from acute illness in the intensive care unit and going up into chronic illnesses that arise from their stay in the intensive care unit. What happens in the clinic is, compared to a traditional clinic where there is a physician and a patient, this clinic, the patient is evaluated by an interdisciplinary team of an ICU physician, which is myself, a care coordinator, which is a nurse, expert in treating geriatric syndromes and post-intensive care unit syndromes, and a social worker who's also a care coordinator who can provide recovery protocols to the patient, a psychometrician to assess patients, and a critical care pharmacist. And this team will work with the patient and their caregivers to provide comprehensive care for brain problems, muscle problems, or mood problems that arise because of their stay in the intensive care unit. Patients who are admitted to the ICUs, majority of them because of acute respiratory failure in which they cannot breathe by themselves and they are on a mechanical ventilator, or because of sepsis or septic shock, which is an end result of most of the time an infection so that they cannot maintain their blood pressure. And with both these things, they are exposed to extreme stressors in the intensive care unit. Along with that, we gave them certain medications such as sedatives and analgesics to keep them comfortable on the breathing machines. And all these medications can lead to certain sequelae. Now they are classified as post-intensive care syndrome, in short, PICS, which essentially means that when the ICU patients survive and get out of the ICU, when they are assessed by standardized tests, they have cognition problems, which is similar to Alzheimer's disease patients. They have mood disorders, which include anxiety, depression, post-traumatic stress disorders, and they have physical problems, which is muscle impairment and weakness. And these constellation of symptoms, known as post-intensive care syndrome, is a rising epidemic in the ICU survivors now. There are certain patients that are at risk for developing the syndrome more than others. The severity of illness is a contributing factor in that. Patients who have low oxygen levels, they are more at risk for developing post-intensive care syndrome. People who are elderly at risk for developing post-intensive care syndrome. People who have delirium, which is acute brain failure in the intensive care unit, are at risk for developing post-intensive care syndrome. So there are a certain group of patients who are at risk for developing post-intensive care syndrome, but at this time it is difficult to say exactly this patient will develop post-intensive care syndrome and this patient will not develop. There are certain risk factors and those patients need to be closely monitored for development of that. The main thing is the burden is so high that essentially everybody should be screened for post-intensive care syndrome after getting discharged or at the time of discharge.